5-star Ortho Lab and Supply, and I wanted to hop on today and discuss orthodontic emergencies. In light of the COVID-19 pandemic, the ADA has recommended that dentists only see patients for emergency procedures, but with orthodontics, it gets a little tricky to determine what is and isn't considered an emergency. So I figured we could go over the article published by the ADA together. Got it pulled up on my computer. You can pull it up on their website as well. I figured we would go over this and take away the bits of information that are pertinent to orthodontics. That way you can figure out how you can best serve your patients during this time. So the ortho section of the article is pretty brief, and it just defines an orthodontic emergency as an acute issue that's either pain, infection, or trauma. And the most obvious examples of that are going to be broken or loose brackets or bands, any steel ties that are poking the patient, or any wires that have become displaced. But before you bring every patient with a pokey wire in, I would recommend that you try to use FaceTime or Zoom to further evaluate the situation. Those are some really valuable tools we have right now. So I would advise you to hop on any type of video chat with the patient and have them actually show you where the wire is poking them, because occasionally, for example, if the wire is just sticking out of the buccal tube, if it just came out, you might be able to talk the patient through guiding it back into that tube, and you'll be able to save them a trip coming in. Same with the steel tie. Sometimes they just get angled in a funny way and they're kind of irritating the inside of the lip, but you can kind of look at that on FaceTime or Zoom, and with your guidance, you can show the patient how they can move that wire into a more comfortable position or move that tie into a more comfortable position and avoid having to schedule an appointment, bring them in, and risking contact. The article also goes on to discuss the adjustment and repair of any appliances if they are broken to the point of harming the patient or if their function is impeded. So if you've got a broken retainer or an expander that's broken, you can go ahead and bring those patients in and get those things fixed. As always, if you've got any other questions or concerns, you can email me or give me a phone call. I'll be here to help you, and in the meantime, stay healthy.